In the last video, we talked about movement terminology, terms like anterior and posterior, medial and lateral, distal, proximal, inferior, superior, greater and lesser. We talked about why these are important and how we can use them to refer to different places on the body with real precision to make sure we know what we're talking about. In this video, I want to talk about another really fundamental way to talk about the body and how it moves. We're going to be talking about the 3 planes of motion in the body. So let's jump in and talk about, first off, what is a plane? And when I talk about planes, I mean P-L-A-N-E. Now, technically, if you look in a textbook, it'll say, a plane is defined by 3 points in 3-dimensional space, and that is true. I like to think about planes as like kind of just like a horizontal slice that you can take out of something. So if we're trying to look at, say, the body, we might just take a slice out of it. Now, there are 3 different planes in the body, and they have specific names that we need to be aware of. The first, and maybe this is review for you, but the first is the sagittal plane, and I will try to draw in 3 dimensions here. So first off, let's take a slice of the body like this. So let's slice kind of like that. So this is kind of like cutting like straight down through the body like this. This plane is called the sagittal plane. A lot of the motions that we care about in sports and exercise and health happen inside the sagittal plane, or they are, as we'll talk about in the future, they're rotations in the sagittal plane, like running, like squats, like walking. So this is the sagittal plane. The next plane I want to talk about, and these are going to be oriented at 90 degrees to each other, or the technical term there, orthogonal. You might hear that word, orthogonal. The next plane that I want to think about is a slice. Oh, and I have an example of this. Here is a picture of the knee joint. This is the femur right here. Here's the kneecap or the patella, and then here's the tibia. Here's the fibula. And this is an X-ray image in the sagittal plane. One of the reasons I want to talk about medical images in this unit is because they're a really great way for visualizing the different planes of the body. So that's the sagittal plane. It's cutting like that. The next plane I want to talk about, it's going to be at a 90-degree angle to this plane, kind of like this. So you could imagine taking a right angle coming off like this. This plane is going to cut through the body like this. It's going to be a horizontal cut like that. And of course, these would kind of intersect like, they would intersect like that. So this plane, horizontal plane, you would rotate in this plane if you were doing like twisting your spine back and forth or shaking your head side to side. Like, no. This is called the transverse plane. Sometimes you'll see this called, and it's a little bit confusing, I'll come back to this, in medical imaging, sometimes you will also see this called the axial plane, because it is along the long axis of the body. Now there's a little asterisk to that, which I should maybe note. Come back and talk about that in a moment. This is the transverse plane, though. Here is a slice, which we saw this before in our introductory video. This is a slice, I think it's actually from an MRI, but this is a transverse plane slice of the knee joint. Transverse plane. So this is like in this image here, it's like we took a slice like this. Slice like that instead. So this is another way of thinking about it. It's like a bird's eye view if the person is standing straight up. So that's the transverse plane, sometimes also called the axial plane. And then the third fundamental plane of motion, I'll pick a different color to draw that. It's called we'll call it the frontal plane. So as you might imagine, it's going to be 90 degrees off like this. It's going to be like that. So that will come down like this. finish that down here. So that is the frontal plane. Let me just label that. Now, this one also has a little bit of an alternative name that you might see mostly in medical imaging. This is also called the coronal plane. Coronal plane. So that's the frontal plane. I have a frontal plane X-ray like this. You can see, this is actually somebody who had knee replacement surgery. You can see the implanted artificial knee right here. It's got one piece that goes on the tibia, one piece that goes on the femur, and you can't see it because it's transparent on the X-ray, but there's like a plastic thing. I think it's plastic, probably some kind of advanced medical plastic or ceramic here that replaces this groove so that the knee can actually flex. But this is a frontal plane image. There's another word for this also. There's another term which is hinted to us here with this AP. Sometimes this is also, maybe you remember from the last video, we talked about how moving this way versus this way is going forward, that's anterior, and going backwards is posterior. I'm immediately realizing that this X-ray is actually mislabeled. So we could talk about the anteroposterior plane. That would actually be the sagittal plane. Probably how this X-ray is supposed to be labeled is mediolateral, because mediolateral is like moving either this way, inside, or towards lateral, towards the outside. Occasionally, and I'll use this because it's kind of a biomechanics specific phrase, but mediolateral plane. Sometimes we'll talk, actually probably most of the time for me, I'll be talking about this green frontal plane as the mediolateral plane, because you're moving in that direction. And we'll talk about in the next video what it means to move in those directions. Okay, so we'll just cross that off and we'll write this is a frontal plane image. Okay, so that's the three planes of the body, and if you Google this, you will see annotated these kinds of things. This will be in the notes for this week as well. Sagittal plane, that's this pink one. The frontal plane, sometimes also called the coronal plane, that's this green one. The transverse plane, that's this kind of cyan-colored one. Now, the little asterisk that I wanted to come back to, almost always, axial is going to be the same thing as a transverse plane. The one exception to that is, suppose you are taking slices, like maybe in an MRI, of the foot. Now, the long axis of the foot actually goes like this. So an axial slice of the foot will actually, let's maybe sketch one out. That might look like, let's say we took a slice right here. We would see probably like some of those, like, the navicular and whatever those bones are, and then the metatarsals would come down like this, and then on top you'd have the talus. That would be an axial slice of the foot, even though it's not strictly speaking in that same transverse plane. So I just wanted to provide that little bit of a clarification there. The main things you need to know: sagittal plane, frontal plane, also called coronal plane, and you'll occasionally hear me refer to it as the mediolateral plane. Transverse plane, sometimes referred to as the axial plane, although not necessarily interchangeably. Lastly, just remember these are planes, meaning they're a flat two-dimensional slice, and that they are orthogonal, 90 degrees to each other. Okay, I hope you found that helpful, hope you found that useful, and in the next video we'll talk about rotations that happen in a plane.